Usually when I see a young woman, they are newly diagnosed, they need a lot of help, they are very overwhelmed, they have questions about fertility, they have psychosocial issues, and they even have questions about hereditary cancer risk. Hence, I decided that we really need to have a program specially catered for these young women to help them navigate through all their problems so that their treatment will not be compromised and can be given in a timely fashion. Nowadays, with more women postponing childbirth and marriage, we see that when a young woman is diagnosed with cancer, they may not have completed their family. Chemotherapy treatment or even systemic treatment for cancer can compromise their fertility. So they need to know this, and if they desire childbearing, they will then need to go for fertility preservation techniques.
The majority of the patients we're looking at these days are actually those who are in the reproductive age group. These women, we will have to help them in different means. So if you want to either save your eggs, you could do it as freezing eggs, or if better still, if you actually have a partner, freeze embryos. Why I say freeze embryos is better, because embryo freezing means we know there's a small being that's already being formed. It is a day 5 baby human, which can potentially grow to be a real human. So we always want to try, if possible, to have embryos instead, because there's more certainty. But for those women who are still single or who don't wish to have the ethical problem of having embryo storage, then saving eggs is the option to have.
Patients can have a lot of anxiety about the treatment that follows. Having a support group allows the patient to understand a little bit more about the treatment from the perspective of a patient. And this is very important because it tends to be better in allaying their anxiety compared to what they hear from their physician. So when there is a new cancer patient being diagnosed, our coordinator will then get in touch with the patient, find out which are the areas where the patient needs help in, and find appropriate channels to help the patient. It is never a one-way thing. It is usually a discussion between the physician, the treating physician, and the patient. What are their goals and expectations of life even 10, 20 years after treatment? And subsequent to this, we will then discuss the pros and cons, the side effects of each different treatment options. And then we work together with the patient to come up with an individualized treatment plan. This is very important because often the patient needs to be trusting to be able to consider different treatment options in an open-minded way. We do not merely regard the patient as a medical condition to treat. In fact, we want to treat them holistically and to meet them where they are in life, to treat them socially, functionally, and emotionally.